Today we are interviewing Brum, the MSF Technical Advisor for Emerging Diseases who are affiliated with Doctors Without Borders. First question. Does the increase in dengue fever outbreaks in Latin America mean there are insufficient resources to control the disease?
It's a good question. The problem is not a lack of economic resource per se, but the absence of a comprehensive approach to disease by the public health programs in the Latin American countries. The health programs often lack consistency and lack, I would say, public officials to help them out, to fund the different programs.
Second question. What should we do to fight dengue?
Dengue needs to be fought on a daily basis. We must never lower our guard. It depends on the state promoting community education that we will encourage people to learn what they can do to protect themselves. On the other hand, people need to develop their own active prevention strategies. Without community participation, as long as there is no effective vaccine, we will never be able to eradicate dengue.
Question number 3. Can you stop the transmission of dengue, and is research being done to find a drug or vaccine to protect against it?
Until now, the only way to prevent dengue has been through vector control, which means fighting the mosquito that transmits the disease. The lack of vaccine can be attributed to several factors. But the main problem is that there are 4 different types of dengue viruses. Serotypes 1, 2, 3, and 4. So to be effective, a vaccine must inhibit all 4 serotypes simultaneously.
And lastly, the 4th question. What is the impact of outbreaks on affected countries?
The main burden that dengue imposes on a country is the huge number of hospital admissions and the number of days that the illness lasts. Caring for a large number of dengue patients requires equipment, trained doctors and nurses, beds and materials, and establishing treatment and isolation guidelines. The main effect is that caring for the patients takes time and resources that a country may not always have. That's why outbreaks in poor countries are worse than other ones. Ms. Salmon, I'm talking directly to you now. We need to fight this epidemic. We need to have the resources to fund our hospitals. Patients are dying. Only you can be the change.